So today we are reporting 80 new cases in British Columbia of COVID-19 in the last 24 hours, bringing the total since the beginning of the pandemic to 4,825 COVID-19 infections. By health authority, 1,526 are in Vancouver Coastal Health, 2,533 are in Fraser Health, 159 are in Vancouver Island Health Authority, 411 were in the interior, and 121 were in Northern Health. 75 infections were among people who came from outside of Canada. Currently, we have 780 active cases, of whom 11 are hospitalized and 4 are in critical care. 2,574 people are at this time under active public health monitoring. We are sad to report 2 new deaths in the Fraser Health Authority, bringing the total to 200 deaths in British Columbia due to COVID-19. Our sincere condolences to all those who have lost friends and loved ones during the COVID pandemic, and in particular to those who lost loved ones recently. At this time, 3,845 people are fully recovered from their COVID-19 infection. There are no new healthcare outbreaks reported today. There are, however, 9 active outbreaks being monitored by the health authorities in our healthcare system. 8 of those are in long-term care facilities or in assisted living, and 1 is in acute care. Among community outbreaks, there has been 1 new community outbreak with 9 confirmed cases of COVID-19 at Loblaws reported in the Fraser Health Authority. Fraser Health Public Health teams are on-site managing this cluster. In Haida Gwaii, there is an outbreak that's being actively monitored, and the update on that outbreak is that everyone in that cluster is at this time considered fully recovered. Public Health will continue to monitor for potential new infections until the outbreak is declared over. Health authorities continue to issue community exposure alerts for a number of locations and flights coming into and out of BC. Please do check these websites regularly to make sure that you are up to date on any potential exposures. So what do today's numbers tell us? We do continue to see new infections in British Columbia. The number at this time is relatively stable, but we are continuing to see them. The number of people in hospital and intensive care units remain low. We are seeing a small increase in infections in the 40 to 60-year age group. We are carefully monitoring this trend because we know that the risk of severe illness goes up with age. And the 2 new deaths in long-term care facility, of course, reflect the vulnerability of this population to severe disease from COVID-19.
On May the 7th, we, of course, released our commitment to surgical renewal. On May 18th, we resumed non-urgent scheduled surgeries. Between May 18th and August the 10th, we completed 77,864 surgeries, 59,446 of which were scheduled surgeries, and 18,418 were unscheduled or emergency surgeries. That's 14,670 in interior health, 21,863 in Fraser Health, 17,681 in Vancouver Coastal Health, 15,894 in Vancouver Island Health, 4,500 in Northern Health, and 3,256 in the Provincial Health Services Authority. Last week, we reported 4,718 surgeries were completed from August 3rd to the 9th. Health authorities have verified their data, and the total number of surgeries completed for the period is actually upgraded to 4,886. This period included the BC Day long weekend, or BC Day, when scheduled surgeries were not performed. This week, we completed 6,132 surgeries, significantly above last year's period. And as you know, vacation management is reducing the summer slowdown due to planned vacation by 52%. Obviously, some vacation time is now being taken, but much less than a typical year. I'm also pleased to report that mechanical issues with one of Northern Health's operating rooms were fixed August 14th. When we postponed surgeries, we made a commitment to patients that you are not forgotten. From ophthalmology to orthopedics to cardiac to thoracic patients, you have not been forgotten. The number of surgeries we report on each week includes surgeries from all of these areas. As we continue our commitment to renewal, we'll be profiling how we'll improve efficiencies and increase surgical cases in several of these specific surgical areas, beginning with ophthalmology. There are nearly 23,000 cataract cases waiting for surgeries, about a quarter of our wait list. I again want to express my appreciation to everyone who's involved in delivering our commitment to surgical renewal and our commitment to patients. With respect to long-term care, I just want to bring an update. Obviously, all visitor safety plans have been completed, and all long-term care homes, with the exception of those with active outbreaks, are seeing visitors at this time. As you know, practice guidelines were set in place on June 30th, and each long-term care or assisted living home has produced and prepared its visitation plan. Wanted to say that resources are being provided to assist facilities in adapting to these new guidelines, and this will be in the coming period up to 4 FTEs, or people per facility, full-time equivalent jobs per facility depending on size. This is up from 3 previously reported, as there was room in the funding envelope to provide additional FTE per site to offset administration costs. As you know, ministry staff are actively reviewing the social and family visitation policy now, as we promised to do. It's been in place now for a number of weeks, and we will take obviously a thorough and thoughtful approach to this review.